So today I'm going to talk with you about why I believe that if you're a life and health insurance agent, that you absolutely should be selling Medicare supplements as part of your practice. Hi, my name's Jeremy Smith, and over the better part of the last 15 years, I've been an agent, a manager, an owner-operator of a brokerage. Over the last 6 years, a business coach, and in that time, I've been traveling the country trying to help agents and agencies grow their practice. Stay with me, because today I'm going to do my best to try and help you grow yours. If you've been on YouTube before, then you know the game. Please like, subscribe, and ring the bell. Thank you. So in a lot of my earlier videos, I made numerous mentions about why I think selling Medicare supplements is such a vital part of becoming a full-service insurance agent. Today I'm going to take a deeper dive in explaining to you why I'm so passionate and why I think Medicare supplement sales should absolutely be part of your practice, okay? We've all heard the statistics that for the next decade or so, there's 10,000 people in the United States turning 65. So there's that. That's a pretty good reason all on its own. Most of those people are going to need a Medicare supplement. So here's the thing. When somebody's turning 65, that's called a T65 Lead for those of you that don't do anything with Medicare supplements. As I've traveled the country, I've seen this so much that people are attacking, for lack of better words, these prospects that are getting ready to be 65. What most people I don't think about is that, man, that's a tough market. If somebody's turning 65, they're normally going to get somewhere in the neighborhood of 30 to 40, maybe even 50 different prospecting attempts in the 2 or 3 months before they turn 65. Whether that be letters, telemarketing calls, door knocks, whatever it is. So you're now, if you're going up for those people, trying to get the business of these soon-to-be 65-year-olds, you're up against so much competition. I'm not saying, there's business to be had there. I'm not trying to say don't get those people, but there is a much easier market to be had than the people that are about to become 65 years old. So one of the reasons why people are going after all of these people who are turning 65 is because that regardless of their health, when they're going into Medicare at age 65 for the very first time, they'll qualify for any policy in the country. It's called guaranteed issue. So they know that anybody that turns 65, they'll qualify. They don't have to do any health underwrites. So that's the good news. The bad news is that most of them don't really understand how Medicare works, and you're really going to have to hold their hand in explaining to them exactly how the whole process works, how the coverages work. I'm not saying that you shouldn't evolve to get to that point, but I'm going to say and guess that most of the people watching my videos right now, from the responses and communications I've heard, you're not selling Medicare supplements at all right now. Okay? So what I want to do is I want to start out, at least right now, and talk to you about replacing Medicare supplements as opposed to selling Medicare supplements for the first time to people turning 65, because it is a lot easier, because we're talking about people that already have the coverage and already understand exactly how it works. Here in just a couple weeks, I'm going to give you some videos out there where I'm really going to break down how Medicare works from A to Z. And in that point, you'll be able to, after you're done with that video, you'll be able to go into somebody turning 65 and really explain to them the ins and outs from the beginning to the end. Today, I really just want to just get into some more details about why I just think you really need to spend a little bit of time and learn about Medicare supplement sales and add that to your practice. And so yes, if you want to compete against thousands of insurance agents around the country going after the just turned 65 population, go for it. You can do it. If you got the education, do it. Or you can focus on the 46 million Americans that are out there right now that are already 65 years old and have a Medicare supplement. These are people that already understand how the Medicare system works. They already love their coverage, okay? You don't have to go and explain to them how it all works. The only thing you really have to explain to them is what the majority of them are already going to know, and that is that their Medicare supplement that they have with a company is the exact same coverage with that company as it is with every other insurance company in the country. Assuming they have the exact same plan, Medicare regulates to make sure that the coverage is exactly the same. There's only one difference, and that is the amount of their check every month for their premium. And oh, by the way, these people are older. Okay, what that means, they're not 65, they're 66, or they're 76, or they're 80. your compensation is based upon their premium, which is based upon their age, so you're making more money on older people anyway. For those of you that don't really know this, there's some big differences between companies too, okay? Most of the time, when I walk out of somebody's home from looking at flipping their Medicare supplement, you very well are going to walk out of that home saving them $300 to $700 or $800 a year for the exact same coverage they had before. Okay, it's not nickels and dimes. You find a husband and wife, you might be upwards of $1,500 to $1,800 a year in savings for the exact same coverage. Okay, you can be a hero. What other thing in our business can you go sell a client where you didn't have to talk them into getting anything? They already had it. And all you did was go in and give them a new one and save them that type of money. There's nothing. And that's why I think it's such a vital part of what a practice should be for a new and upcoming insurance agent. If you're struggling right now to make ends meet, or really at that point where you're still trying to build your business, let me just point out a couple obvious advantages to selling Medicare supplements. Number one, you're now selling a product where you're walking out of their home and saving them money as opposed to costing them money. That's a good thing. If you're selling life insurance or final expense, boy, that sale is probably going to be a lot easier now when you just created the savings / premium to pay for that life insurance policy. It's a great product to dual sale with. In fact, here in a couple weeks, I'm going to do a video where I show you a presentation that actually walks from Medicare supplement right into a life sale. Another great thing about Medicare supplements is they're really easy to qualify for. It's not fully underwritten. They're called simplified issue. It's 17, 18 questions that are filled out in an application and issued inside of a week and a half. You've got the money and the commissions in your pocket normally inside a week and a half to 2 weeks, so it's quick issue. It's just a great product for those of you that are starting out. You're still in that in-between stage of building your practice. And you know what? Even if you're a rock star and you're a stud, your goal, assuming you're still trying to build your practice to some degree, it's really to build clients. So if you're selling big life or annuities or long-term care, what better way to sell those products than by creating a client? All of these people need a Medicare supplement. Okay, you can make a client with that product and then move on doing fact finders and selling all these higher level type products to your customers. Yes, it's not a huge compensation product. On a Medicare supplement, you're probably only getting paid, $250 to $350 probably an application. But the cool thing about Medicare supplements is that you get paid that every single year for the next 6 years in most cases. And then in most cases, you're getting a decreased comp for another 4 years after that. It's a great way to start building your residual income, which you and I both know is a great way to start building your practice. I guess final little point here is that the cool thing about Medicare supplements is that almost every person you run into that's over the age of 65 is a prospect. It's just so easy to walk up to somebody and to ask them, do you have Medicare? Have you had your policy reviewed in a while? Most seniors are all going to understand that the point that we talked about earlier, that their Medicare supplement is the same across the board, regardless of what company they have. The only difference is price. So it's a real easy prospecting conversation to say, do you have a problem with me taking a look at what your price is and see if I can save you some money? Who doesn't want to save some money? If you don't have contracts for Medicare supplements, there's a bunch of IMOs and companies out there that offer it. If you don't have any, hit me up. I'll get you in touch with my favorite IMO that has access to not only every insurance company that offers Medicare supplements, but they've got a lot of quoting tools that are really cool. So when you walk into somebody and say, how much are you paying for your Medicare supplement? You put in their zip code and their age. You can literally show them on an app every company in the country and what their prices are. So instead of being a salesperson and saying, I think you should buy this one, you can really be a broker and show them, here's all the options, which one would you want? That's a trial close there. Coming up here in our next video, I'm going to actually show you how a presentation of a Medicare supplement should work. So if I've got your attention, make sure you tune in next week so you can actually see the actual presentation. Here in a couple weeks, I'm going to break down exactly how Medicare supplements work and the ABCs of them. I really hope that you take this to heart and add this to your practice. Don't forget to like, subscribe, and ask questions. I'll love to get back with you, and we'll look forward to seeing you in next week's video.